Hi, Dr. Jen Andrade, the Active Persons Chiropractor, and today we are going to be talking about some stress relieving techniques. This is tying in to previous videos about the pillars of health, and this really influences two different pillars. It influences the mental health sphere in that rest and relaxation pillar as well. There's a lot of different techniques, but we're going to talk in general about breathing techniques. So you may have heard of that. You may have think of meditation with breathing techniques, and there is a difference. So breath work is doing intentional type of breathing to achieve a certain type of goal, whether that be stress relief, reducing your heart rate, mindfulness. You can be using it for a lot of different things. And meditation typically uses some type of breath work, but then there's also a mental component. So they might be doing a guided meditation or doing other things, but there is a little bit of a difference. So meditation has an extra layer, and there's lots of different types of meditation. But I want to talk about breath work for this specific video. So there's a couple different types that I really like. So I'll talk about them briefly. One of them you've probably heard me talk about before, and that is 4-7-8 count breathing. And the goal of this type of breathing is to get your body more into parasympathetic mode, which is your rest and digest, and to help de-stress, bring your heart rate down, bring your blood pressure down, and bring more mindfulness to your body and get out of your head when you feel really stressed. So pretty simple. You breathe in for 4 counts, hold for 7, and then breathe out for 8. And you do that several times until you kind of get more in that relaxed state. That's 4-7-8 count breathing in a nutshell. The other type of breathing that can be really helpful for anxiety, stress, depression, those types of things is diaphragmatic breathing. So the diaphragm is the muscle that separates your chest cavity from your abdominal cavity, and it's actually the muscle that is strongest and best and most efficient at helping us breathe. So it should move up and down to help propel the air out of the lungs and create pressure to do that. But a lot of us don't actually use our diaphragm to breathe. We are constantly stressed. We are constantly in what we call the fight or flight state. So we tend to do really shallow breaths. So we're breathing in through our chest and through some of the muscles up here in our shoulders because we have extra muscles to do that. In case something happened to our diaphragm, we need to be able to breathe. But unfortunately, because we are constantly in that stress state, a lot of us unknowingly are breathing really shallow and through our chest. So diaphragmatic breathing is intentional in trying to use that diaphragm to moderate that breathing and to help you get into a more relaxed state. I don't want to go too far into it to this video, but those are just a couple of different things that you can use that can be really helpful for mindfulness, stress, anxiety, depression. Basically, any kind of mental health thing can be benefited by the mindfulness in the breathing from breathwork. Hopefully you found this helpful. Thanks for listening. Dr. Jen Andrade, the Active Persons Chiropractor.